The conference code, followed by... Thank you. After the tone, state your name, followed by the pound or hash sign. You will now be placed into conference. To mute your line, press star 6. To unmute, press pound 6. Your conference is being recorded.
That will also be able to assist consumers to enroll. And then lastly, but probably not the one avenue that we're going to promote as much, is that's the paper application. But we will have paper applications available for those who just may not be able to do away with the paper. So moving on to open enrollment, I think most of you all know this, that open enrollment begins October 1st through March 31st. That's the initial open enrollment period. And the effective date for those who enroll is January 1st. And particularly for the QHP population, there are enrollment cutoff dates. So between October 1st and December 18th, if a person enrolls and we consider enrollment in that if they have any type of premium payment that they have to make, that must be received and processed by the 18th of the month in order for the enrollment to be effective the 1st of the 1st of January, and subsequently the 1st of the next month. So moving on to the next slide, what should consumers expect? And I think that this is an area that we need to just really be able to make certain that consumers come with some realistic expectations about their enrollment process. The process could take up to about 30 minutes in order to complete, and 30 minutes is actually probably the fast route if they have all of their information available and together with them. They need to know important information about themselves and about the persons who they're applying for, such as their Social Security number, salary information, employment information, etc. So, it is important that the consumer doesn't think that they can just come and not have any information. The system will ask for a lot of information in order to enroll someone into the program. They're also, the consumer, should they have, they become QHP or Qualified Health Plan eligible, they may have a premium that they have to pay. And as I mentioned, in order for them to be enrolled, they have to be able to pay that first month's premium in order to start their coverage. The forms of payment that will be accepted include credit card and debit card, check, money order, and ACH. And ACH is just a kind of an electronic or e-check type of process. So moving on to just to give a little information about our connector entities. As many of you are aware, we put out a grant earlier this year for connector entities in 6 regions of the state, as indicated on the map on the next slide. And these connector entities are primarily responsible for in-person assistance and helping to facilitate the enrollment into Medicaid, MCHIP, and into qualified health plans. So we have divided the state into 6 regions, and we have connector entities for each of those regions, and they're listed there: HCAM for Central Region, Calvert Health Solutions for Southern, SEEDCO for Upper Eastern Shore, the Lower Eastern Shore is Worcester County Health Department, Western is Healthy Howard, and Capital is Montgomery County. So essentially the connector entities will have oversight for the in-person assistance that will be offered through navigators and assisters that will be working out in the communities. And one of the reasons that we chose to adopt this kind of regional approach is because we wanted to make certain that the connector entities really are in tune with the region and the area in which they serve and with the populations that they serve for that region. And we didn't just want one person to have all of that heavy lift, but we wanted to make certain that the entities really understood the populations that they were serving and familiar with them. On the next slide, it just talks through, so the connector entities aren't working alone. They have partners. Many of them, some of them are some of the health centers that I hear that have joined on the call will be working with the connector entities to, again, help to get persons enrolled into the program. So I'm not going to go through all of the names, but I just wanted to give you a flavor on this slide and the next slide of all of the partners that are working with the different connector entities. So on the next slide, there are other opportunities. As I mentioned, the local health departments and the local departments of social services are also very involved in the process and can facilitate eligibility determination for subsidies and Medicaid and MCHIP enrollment, and they will be working closely with many of the connector entities. So many of the connector entities are establishing times when they will have navigators and assisters on site there at the different local health departments and local departments of social services, and they're working through handoffs that will occur should someone who comes can't be served by a caseworker, since a caseworker can only facilitate enrollment into Medicaid and MCHIP. There are also certified application counselors. That is a relatively newer term. The federal government entered that into the regs just recently, or a few months ago. And so we are just at the state level in the process of establishing some regulations, and we're actually going to disseminate those regulations and put them out for public comment over the next couple of weeks. So application counselors will essentially be able to facilitate enrollment into health plans. They will act very similar to a navigator. The difference is that because of some of the affiliations that application counselors have today with MCOs, they will not be able to enroll someone into a managed care organization, but they will be able to help facilitate QHP enrollment. Application counselors are not funded through the Maryland Health Benefit Exchange in the same way that the connector entities are. So as an example, maybe a hospital or maybe even a health center would like to have someone who already works for them to get certification to be an application counselor. So that is how an application counselor will serve in this program. I know there's a big question regarding application counselor and the training, and also training for some of you who are federally qualified health centers who have received HRSA grants for your navigators. And so we are going to put out information very shortly regarding how, application counselors as well as those federally qualified health centers who have navigators, funding for navigators, will get and receive training. So stay tuned for that. And then lastly, insurance producers, they also, too, are a viable option for a person to go to be able to enroll into a qualified health plan. And they are compensated directly through the carriers in which they work for now. So just to give you a little details about navigator hiring and training, many of the connector entities have, if not completely filled their navigator slots, they're very close to hiring all of their navigators and assisters. We are starting training for them next month, or actually in a few days. The assister training And again, I just put the role just to remind everyone of who can do what. So assisters will be responsible for education and outreach and can facilitate enrollment into MCHIP and Medicaid. They cannot assist with QHP enrollment. Their training will include 5 hours of web-based training as well as 5 days of instructor-led training. And they must pass an exam in order to be able to serve as an assister. And like I said, their training will begin in September. For navigators, individual navigators can do outreach and education and facilitate enrollment into Medicaid, MCHIP, and into QHP. So they can do all. Their training includes 5 hours of the web-based training and then 7 days of instructor-led training. They will receive certification and must pass an exam in order to receive that certification. So we are, taking training very seriously. As I mentioned at the beginning of the call, I'm sure all of you understand that sometimes insurance can be very complex. So we want to ensure that our navigators and assisters have all of the information that they need in order to be able to enroll persons into the program. Moving on to the next slide, just to give you a little information about our Consolidated Service Center or our Consumer Support Center. We have outsourced, we have a vendor, Maximum Health Services, that will be actually running our call center. And that vendor will have a number of tools that they will be able to use in order to help serve the customers who call in. We have a customer relationship management system, which includes a database and a knowledge base so that all of the information and training and information can be there at the rep's fingertips as they answer questions and navigate their way through phone calls that they will receive. And then we will also have a customer interaction center or system that will do all of the IVR, and that's the interactive voice response and workflow of the calls and automatic call distribution. So just wanted to just say that, just by indicating in our CRM and CIC, we have a very state-of-the-art call center that will be able to handle, large volumes of calls. We did a soft launch on the next slide. We opened, actually it was August the 5th, we opened, whereby consumers can call in today and get basic information about the Maryland Health Connection and get, just questions about what they've heard and things like that can be answered today. We officially began to enroll everybody into the program as of October, but this soft launch will just help facilitate with questions. As I mentioned, we will have upwards of about 125 staff that will be on board, and we will have a full complement of bilingual staff, Spanish-speaking bilingual staff. We will have a command center that will be on point all the time to just watch all of our call volumes and, when call volumes are high, make the necessary adjustments so that we can ensure that we serve all of our customers that call in. And then we have a full complement of supervisors and quality assurance personnel and trainers, and then has an escalation team as well that will work with being able to respond to any complex matters that come through that the call center representatives aren't able to address. On the next slide, this gets into a little bit more detail, probably more than you want to know, but, we'll have a couple of tiers of representatives. Also feel confident that in the same way that we are certifying our navigators and assisters, the call center representatives will get permits. And they essentially will be going through the same training program or same certification as our navigators will to get the full complement and comprehensive training in order to be able to enroll someone into the program. They can serve like navigators, Medicaid, MCHIP, and 2HP. They will also be helping with the informal resolution for appeals that may come about. We will also have a dedicated appeals unit that will work very much in concert with the call center. The call center will also assist with help desk functions, so if someone is having password issues or things like that, they will be able to assist with that, as well as billing and payment matters. So as I mentioned earlier, a person who enrolls in a qualified health plan may have a premium to pay. So as the program is billing the consumer for the first premium payment, and then all subsequent payments the consumer will make to the carrier. So we'll need to be able to assist callers that may call in regarding that first payment. And then we will also have a language line that will serve over 200 languages should we get persons that speak languages other than Spanish. And just a couple more slides as it relates to the call center. We also have a large fulfillment center which will handle all inbound and outbound mail and general correspondence that come in related to the Maryland Health Connection program. On the next slide is just the contact information, and I think Anika is going to provide you these slides. So you'll have the phone number for the call center as well as the address. And our hours for the call center on the next slide. In open enrollment, beginning October 1st, will be open 7 days a week, Monday through Friday, 8 to 8, Saturday, 8 to 6, and Sunday, 8 to 2. And for right now, those are the hours, and we are kind of leaving those as tentative hours because we may expand the hours depending on the volume. So we may go to 24 hours 24/7 if we need to in order to handle the demand if that's necessary. And then during non-open enrollment time, we will be open just Monday through Saturday, 8 to 6 Monday through Friday, and 8 to 1 on Saturday. So that concludes my presentation as it relates to kind of enrollment and our consumer assistance program. And I'll turn it over to Sally, and then, any questions that you may have, just jot them down. And once Sally finishes, we'll be happy to take and answer any questions that you may have. Thank you.
Thank you so much, Leslie.
Thank you, Leslie. Hi, everyone. Thank you for this opportunity to share this information with all of you. As mentioned, I'm Sally Smith, Deputy Director of Marketing and Communications for Maryland Health Connection. What I will be going over with you today is just a few of the options we have here that we're deploying to really get the word out about Maryland Health Connection and provide some resources for those of you who are also helping us get the word out, which we very much appreciate. So on the next slide, as you can see, I'll be just touching base on our websites. We do have two. I'll discuss a couple of the outreach resources which we have available, talk about our social media program, and the upcoming marketing campaign. So just to start off with our website. As I mentioned, we do have two websites. The first one here on this slide is marylandhealthconnection.gov. This is our consumer website, consumer-facing. This will change come October 1st. We are in the process of a redesign. So when you come back to marylandhealthconnection.gov October 1st, you will see a redesigned, it will look very different website with extended information and also where people can actually shop, compare, and enroll online. For now, we do have some good content out there. There are plenty of resources which you can download and use to share, and many of them explain Maryland Health Connection, changes to Medicaid, and such. I'll get into those in a few minutes. But also, just to stay in touch, you can sign up for our monthly email updates, and you can also text for updates. You can text connected to 96000. And again, once you get on the site, and I encourage you to do so, please explore it. You'll see that we have frequently asked questions, and lots of materials and resources to download. Our second site is MarylandHBE.com. This site I'm sure most of you are familiar with. This is our stakeholder website. It has been up since we were established. It includes our history timeline, minutes from board meetings. It has very rich background content on who we are and how we were established. Advisory committee and consultant reports. We have some multimedia files. Also on there is research, a great environmental scan of the entire state of Maryland that compiles many different resources to give us a picture of the uninsured in Maryland. So I highly encourage you to check that out. It's a great piece of research to reference. Calendar of events, both consumer-facing and sort of inside industry events. And you may also register for updates from this website. So once again, a great place to go and hunt and peck around and find some good information. Particularly under the resources section, again, that's where you'll find a lot of our materials that are easy to download and use for discussion around Maryland Health Connection. So our outreach resources, this is what I'll get into here. Really the purpose of these materials is to educate consumers regarding health coverage in general and insurance literacy, to discuss Maryland Health Connection, who we are, and also to convey the changes to enrollment, Medicaid, and the changes as a result of the Affordable Care Act. The materials I'm about to go through were designed for distribution at events, gatherings within your health center. They can be for your staff. They can be used directly with consumers who have questions. All of the materials are tested. The messaging is consistent. They're written in plain language, and they follow Maryland Health Connection's graphic standards. It's really an opportunity for our partners and stakeholders just to have information at the ready to once again share and get a better understanding of who we are. So on the next page, one of our first pieces is, I think there might have been a slide before that, but maybe not. Well, here we have, yes, here we go. The first piece is Maryland Health Connection overview. So this is a great piece to, introductory piece for yourself or to share with your staff. One thing to remember is that we did design these with the intent that they could be printed off easily and shared. So you can print this in either color or black and white, and the icons and everything should come across clearly. This particular sheet, as I mentioned, is an overview of Maryland Health Connection, how to shop, compare, and enroll once we open. It touches on the changes to Medicaid, the importance of coverage, and essential health benefits, which I'm sure you're all familiar with. Our next piece really comes from CMS, actually. It's a wonderful glossary of medical insurance terms. It's available in English and Spanish, so this particular piece is just a reference to those glossaries, but certainly you can go online and download the actual glossaries which break down health insurance terms. One possible use for this, if you're trying to get your staff or if you have a newsletter to your consumers, you can pull a couple of these definitions out and drop them into newsletters or share them around the health center, and it just sort of gets people a little bit more immersed in a more easy way on these sometimes complicated insurance terms. So those are definitely helpful tools. The next one is a presentation. This is a PowerPoint which you could download. Once again, it's a great tool to go through with your staff just to let them know what's going on, what the Maryland Health Connection is, and it walks through essential benefits, importance of health coverage, and some basics. So that is also a good tool I'd encourage you to look for. The next one is the Medicaid fact sheet, we call it. It includes some basic questions people often ask about the changes to Medicaid, talks about those changes in 2014, and touches on the PAC program and how to apply and where to get for help, where to go for help, excuse me. And then our next one is a nice sort of summary cheat sheet, if you will, for federal poverty levels, and kind of gives a guideline for who may be eligible for Medicaid or tax credits and cost-sharing reductions. So this is a tool many of our partners use daily when having conversations with consumers. The next one is an event handout. Again, this is sort of a one-pager of Maryland Health Connection. This is very helpful. It's basic information. We call it an event handout because it is single-sided, so it's less expensive to print and duplicate and to share with groups. And then lastly, for the resources, I included in here a shop fact sheet. This is a very basic overview of the Small Business Health Insurance Options Program. And I think at this juncture, of course, we will have more information as we get closer to the launch of SHOP in January. But if you go to our websites today, you will find two basic fact sheets on SHOP. So I think you may find those helpful. So then moving on to social media. Actually, before I do, I just want to reiterate that if you do go to either of our websites and look underneath resources, you will find all of those materials to download and more. That was simply a representative of what we do have. So for social media, we launched our social media program in July. It is, once again, our goal continues to be to discuss health insurance and financial literacy and really to keep that conversation going. As we get closer to open enrollment, we will certainly include details around that. We share news and outreach and also news of our events that are coming up on our Facebook and Twitter channels. So just starting with Facebook, you can see this is an image of our Facebook page here. We encourage everybody to go and like us and explore this page and see the kind of communication that we're offering. Facebook really represents our main consumer engagement channel within the social media realm. People can comment. There's an active and lively discussion. And there are graphics and videos. It's just a nice place for us to extend our brand and interact directly with consumers and stakeholders as well. Twitter is our real-time social channel. We really engage in a live way within a conversation with our network of partners and influencers within this channel. And there is a lot of retweeting and sharing, so sharing of information. So I encourage all of you to, if you're on social media, to go to Twitter and to follow us. And then lastly, right now we also have a YouTube channel. This is really our video repository. It's a dedicated Maryland Health Connection channel. And you'll see that we have several videos out there already. Our overview of Maryland Health Connection, which is in English, Spanish, and closed caption, as well as one video clip, which is behind the scenes for the filming of our marketing, our TV campaign. And we fully expect this channel to get blown out over time. We are currently underway with planning and developing testimonial videos, people from across Maryland who are uninsured, speaking about the importance of insurance, and also tutorial videos which will help with navigating through the online application. So lastly, I just wanted to talk about our marketing campaign. We are launching the statewide marketing campaign September 3rd, right after the holiday weekend. You will start seeing information about that, and you'll start seeing our ads after that point. This is the statewide marketing campaign, which is really sort of the air cover, we say, across Maryland. The health connector, the connector entities that Leslie mentioned earlier will also be doing their localized marketing as well. For the statewide marketing campaign, we will have two phases. In September, it's general awareness building, and then, of course, come October 1st, the messaging will be more direct around Enroll Now. We anticipate an integrated campaign of TV, radio, outdoor, which means billboards, bus sides, things like that, print and online ads, and we will also have collateral for distribution in September, brochures, posters, and flyers. Our initial launch will be lighter than what's expected to happen in October and October 1st around the real launch around enrollment. So that is an overview of where we're at with marketing and outreach. I do encourage all of you, again, not only to go to the MarylandHBE.com website, as it says here, but also to go to MarylandHealthConnection.gov and download the fact sheets and distribute. Just know that we're continuing to develop these materials all the time, so it's worth it to come back and check these sites to see if anything new has been posted. Thank you so much for your time. I appreciate it.
Thank you so much, Sally.
You're welcome.
Now, I guess we can open the floor for any questions that you may have. Don't all go at once. So does anyone have any questions for Sally or Leslie?
Yeah,
Good afternoon. This is
Good afternoon.
Jose Luis with Community Clinic. Quick question: are there other languages being considered for the outreach materials besides Spanish?
Yes, actually, the connector entities are the organizations that are in place to really touch the localized community and understand what the specific community needs are in each of those regions. So they are developing their own in-language materials. So it really depends on the region, but yes. And as Leslie mentioned, we do at the call center have not only bilingual folks on the phone, but access to, I think it's up to 200 languages when people call in for support.
Thank you, Sally, and thank you so much for your question, Jose. I know one other person had a question as well, so speak up now.
Hi, this is Elizabeth. Can you give us some more detail on what our person's supposed to be, our outreach and enrollment person supposed to be? I am representing a community health center, and I don't know if our outreach and enrollment person is supposed to be an assister or a certified application counselor. Can you tell me what the difference is?
So, have you been in contact with a connector entity? Do you have a partnership or any type of an arrangement with a connector entity?
We are working on one, yes.
Okay, so it will really depend on what that arrangement is as to whether or not, your person will be an assister or a navigator. And that will have to be, handled specifically with the connector entity that you're working with.
Okay. All right, so then they would have the details in it of what their role is and what our role will be then?
Well, yes. I mean, they're going to need to, do you know what connector entity you're working with?
Yes, Park Heights Community Alliance.
Right, no, so they're not a connector entity.
Okay.
Yeah, they're not a connector entity. So it sounds like you're, working with, I'm not sure. It sounds like you might be working with an entity that is, will probably have application counselors if they're not working with a connector entity. So again, I can't necessarily answer that because, depending on your relationship with either a connector entity or your relationship with an organization who plans to become a application counselor entity, it will depend on what the two of you all feel are the needs of your particular center. So, for instance, if your center has a lot of, persons who are in the Medicaid, who would likely qualify for Medicaid, then you may just need an assister. But if you're seeing persons with incomes above the Medicaid levels,
you may decide to have a navigator type of person there. That's if you're working with a connector entity. And if you're not working with a connector entity, then you would be an application counselor. But it really all depends on, what the relationship that you have with the partner that you're working with.
Okay. Thank you.
Yes, hello?
Hi.
Hi, this is Akwete from People's Community Health Centers. And, excuse me, I wanted to know when training are going to begin for first partners and for entities that are not partners with connectors. Are we going to have training, and when is that training going to begin? Thanks.
So we're offering training to our connector entities, the navigators and assisters that make up the connector entities, and that training will begin in September. For the application, those organizations that will become application counselors, that training will occur. Those dates have not yet been determined as of right now. If you're not falling into one of those two categories, we're not offering training statewide just for everybody. So, you would need to decide as a organization if you plan to become application counselor or if you have some arrangement with a connector entity.
Okay. So, can we operate and help in this enrolling our patients without being an application counselor? Can we do that? Or do we have to be
you can certainly assist with the tools that are available, but you wouldn't be able to have the tools to necessarily help to facilitate enrollment. But you're welcome to show someone, the website and things of that nature. But any time you're actually facilitating enrollment, you have to get certified in order to do that. Again, as either a navigator or sister, or as an certified application counselor.
Okay, and my last question is, so if the organization as a whole doesn't become a certified application counselor, do we use assisters or,
So assisters and navigators are associated with connector entities. So if you are deciding to become an application counselor entity, then that's what your staff will be referred to as certified application counselors.
Okay. All right, thank you.
It's so confusing.
Yeah, but thanks.
Thank you.
Hi, this is William Seabury from Family Health Center of Baltimore. And I just want a little bit more clarity as it relates to like a definition of a connector entity.
So a connector entity is an organization that has and that will receive grant funds to provide in-person assister services through navigators and assisters. And so we have designated the 6 connector entities throughout the state by region, and they will receive grants, and they are in the process of hiring persons either as navigators. Navigators will be certified and are able to facilitate enrollment into Medicaid, MCHIP, and the qualified health plans, and assisters will be able to facilitate enrollment into Medicaid and MCHIP only.
Okay, so there are only 6 connector entities throughout the entire state of Maryland?
Yes. Now, they may have, there were several slides that showed their partners, so they may be working with various partners to help do that. But
within the region?
Right, within that region.
Okay.
So the difference mainly is that the connector entities, those designated as connector entities, are only funded through the Maryland Health Benefit Exchange. So anybody else, like the application counselors who may become certified, would not get any funding through the Maryland Health Benefit Exchange.
Thank you for your question. Does anyone have any other questions?
Hi, I'm Wendy Korick from Community Clinic. I just have a quick question definitionally. You said that after March 31st, it's, quote, non-open enrollment. Can you define what that is?
So persons that may be eligible for qualified health plans, so Medicaid you can enroll anytime you choose. But if you are eligible for a qualified health plan, you can only enroll during open enrollment. Similar to, on your own job, the insurance that your employer offers you, you have an open enrollment period. So it's very similar to that. And the only time enrollments can be done outside of the open enrollment period is when there's a qualifying event, such as you get married or divorced or something of that nature.
And when does open enrollment begin after March 31st?
It begins in October of 2014.
So it'll be the same cycle every year?
Well, it'll be October to December.
Oh, I see, okay.
Every year.
Or January 1st. Okay, thank you.
You're welcome.
And as it relates to the training taking place on Tuesday, we registered for that, and I saw that there's only 25 spots available. Are we going to be contacted as to where the location of that, or do we choose that ourselves, or how does that work?
So just for the other callers, you must be affiliated as a partner with a connector entity. Is that right?
Yes.
Okay. So, yes, we will send you a training link that will have all of the details associated with the location and all of that information.
And we can expect that, I would assume, tomorrow or the day after then, right?
Absolutely. Mm-hmm.
Yes, hello?
Yes.
Hi.
Yeah, this is Akwete again from People's Community Health Centers, and I wanted to ask if the certified application counselor will have the same access to the same material as the navigators and the assisters.
Yes.
To help assist in enrolling patients.
Yes.
Okay.
It'll be very similar.
Thanks.
Thank you for your question. Any other questions? I also want to point out that we have Alice Middleton from the Office of Planning to talk or to answer your questions about the PAC program. So if anyone has any questions regarding the PAC program, you can ask her now. Thank you so much, Alice, for also being on the call with us.
Sure, no problem.
Does anyone have any questions about the PAC program?
Yeah, I have a question.
Yes, please ask.
This is Akwete, and I wanted to know how long it takes for a PAC application to process.
So right now we are processing applications at approximately 19 days.
Okay. All right. Thanks.
Thank you for your question. Anyone else? No other questions for the exchange or for Alice around the PAC program? Okay. All right. Thank you so much, everyone. Thank you, Sally. Thank you, Leslie. And thank you, Alex, for being on the call. The recording of the slides from today's webinar will be available for your convenience, so you can pass it on to other staff members. Please look out for our follow-up email with the recording and the webinar slides. Also, please remember that we have another webinar on September 5th around ACA, and it's going to be by Sean Frick, who's Associate VP of PCA and Network Relations from NAC, and he will be leading our webinar, and the topic is the national perspective of the ACA, and you will get a, hi, did anyone say anything? Okay, so you will get to ask Sean any questions you have regarding his presentation as well. So before I close out for today, does anyone have any final questions or thoughts? Okay, I'm hearing none. So all right, thank you everyone for attending, and thank you presenters for presenting. I thank you so much for your attendance today, and hope to see you on further meetings and webinars, and I hope you found this one useful. If you have any lingering questions, please feel free to reach out to me at 301-577-0097, extension 127. Thank you so much, and have a great day. Bye-bye.